In a remote village of Karnataka stands a house of hope. Chittadhama, shelter for the homeless with mental illnesses, provides hope to those who have been separated from their families or who have been disowned by them. A team of psychiatrists, psychologists, and social workers from Chittaprakasha Charitable Trust provides round-the-clock specialist care and medication to Chittadhama's residents. Home to around 30 men and women suffering from varying degrees of mental health disorders, its vision is to reintegrate them with their families and the society and help them live a life of dignity. This vision was shared by another organization that played a crucial role in turning the dream of Chittadhama into reality, the Infosys Foundation.
What happens if someone is mentally ill and they don't have anybody? Somebody is mentally ill, the family doesn't want to identify, because in our country if someone is mentally ill, we want to distance them. Someone is mentally ill, but if they require some time to recover, and then they will be normal. In Bangalore we have Nimans, but in rural area we don't have. That made me to think about a hostel or a hospital or an area where, in a tribal or rural area, people can stay there and get cured or looked after. That made me to start Chittadhama.
Conceptually, Chittadhama came into existence in about 2009, and that was a time when the land was bought, and then we were looking out for some donors or resources to kind of build the place to start, and that is when Infosys Foundation came into the picture, and they very magnanimously and graciously said that they would bear the entire expenses of the building. So groundbreaking was done in 2009, and within a year in 2010 the keys were handed over to us, and that is when we slowly started getting our residents and starting our work.
Apart from providing shelter to the residents, the building also facilitates regular psychiatric camps for patients from the surrounding villages. Medicines supplied by the state government are distributed free of cost to these patients. But the supply of medicines is erratic. They are also expensive, putting them beyond the reach of these patients. The foundation took note of this issue and granted funds to the trust to ensure a steady supply of required psychiatric medication under the Manu Malige scheme.
This Manu Malige scheme is a real godsend because they started giving us free medicines. So now 95% of the medicines that we require as for our residents is taken care of, and everybody who attends the outpatient, our medical camps, is given free medicines. As a result of which one finds that there is a more regular attendance and hence better results.
The Foundation's timely intervention and the efforts of the doctors and caregivers of the Chittaprakasha Charitable Trust has had tremendous impact on many lives. More than 30 residents have been reunited with their families. Those without families continue to be cared for by the team at Chittadhama.
Many people have been cured, who stayed there, they have come out and leading a normal life. And who are not able to, at least they have a shelter, they are not on the road. That gives us a tremendous satisfaction.